Welcome. This is Kyle Hoskins, Manager of Policy and External Affairs at Connect for Health Colorado. This presentation will focus on annual eligibility redeterminations and plan renewals for individuals and families. This presentation is designed to help customers and those working with customers better understand the redetermination renewal process for 2015. For our certified assisters and service representatives, this will serve as an introduction to Connect for Health Colorado's redetermination renewal processes in the individual market and will be followed with additional training for certification and recertification. For this presentation, we will first review a month-to-month overview of annual eligibility redetermination and plan renewals in Connect for Health Colorado. We will then move into two customer walkthrough process flows and wrap up with what our customers and certified assisters can expect leading into open enrollment. Connect for Health Colorado will help customers through the redetermination and renewal process if they need assistance, but we will not supplant the relationship that our customers have with their trusted assister. We will provide customers with the ability to renew coverage through their online user account with a certified broker, agent, or health coverage guide, or over the phone with our trained service representatives. So beginning the month-to-month overview, first we'll start with what customers and those helping our customers can expect in September. So in September, customers may receive a notice from their health insurance carrier notifying them of any changes in their current plan selection. Many plans may have changes in provider networks, premiums, deductibles, and copays. This notice might be referred to as a notice of reasonable plan modifications, and if a customer's plan is available to them in the upcoming plan year, their health insurance carrier is required to send this notice no later than October 1st. If you or your customer have questions regarding this notice, it is important that you call the carrier directly. The carrier will be better positioned to answer questions related to benefit and network changes. So Connect for Health Colorado will continue to release its monthly customer e-newsletter, Connect to Coverage. In this newsletter, customers can find updates on the redetermination and renewal process and what to expect in the coming months. Additionally, we will continue to provide updates to our certified assisters through our weekly Friday Connect emails. These will be going out in September, and they'll continue to go out each month and on a weekly basis for our certified assisters. So on September 15th, online training will begin for our certified partners, and this training will include a more in-depth review of the redetermination and renewal process. We will also be developing collateral material toward the end of September to aid in customer education and outreach. This material is focused on redetermination and renewals, so a large chunk of our marketing collateral will be ready around the end of September with the remainder coming in October, but as far as the collateral that we're discussing here, it's related to training resources for this specific process, and we'll also try to make the majority of those materials available to our customers through our public website at www.connectforhealthco.com. So moving into October, by October 1, customers will receive a notice from their insurance carrier if their current plan will no longer be available to them next year. This notice, again, will be sent from the carrier directly to the customer, and it will be sent to them no later than October 1st. So if a health insurance carrier decides not to offer a plan the following year, they must notify customers of this change. Then beginning October 15th, customers can preview plans that will be available to them in the next calendar year at connectforhealthco.com. Previewing plans will allow you and your customers to review plans available in their service area prior to open enrollment. You can browse, compare, and place a plan in the cart in advance of November 15th if you want to beat the rush. And then shortly thereafter, starting October 20th, Connect for Health Colorado will begin to send redetermination and renewal notices to customers by email or paper letter, depending on the preference that they provided to us in their user account. So depending on the customer's circumstance, they will get one of two notices. These notices will be sent from Connect for Health Colorado, but will be co-branded with the customer's carrier. So if a customer is enrolled in a health plan and a standalone dental plan, then they will get one co-branded notice for their health insurance coverage and another co-branded notice for their dental coverage. If they're just enrolled in a health plan, then they'll get a co-branded notice that will have their health insurance carrier's logo on it, as well as Connect for Health's logo as well, indicating their options. So the two different notices that a customer can get, so they'll either receive one or the other, they will not receive both, is going to depend on their eligibility circumstance, if they're receiving the tax credit, and whether or not their plan is available to them. So the first notice would be sent to customers who are eligible for their plan, and their tax credit is available for renewal if applicable, if they're receiving that. So if a customer receives this notice, then the customer does not need to take any action. So a customer will receive this notice if we are able to redetermine their federal tax credit and their current plan is being offered to them and they're still eligible for that plan in the upcoming year. So this notice will let them know what their tax credit amount is, if applicable. So if they're currently receiving the tax credit and we're able to redetermine their eligibility, we'll put the amount of the tax credit in the notice. That amount will be updated based on the new second lowest cost silver plan available to them for the 2015 plan year and any updated ages of the account holders on that plan. So there will be updates to the amount of their APTC, and we'll also provide the plan that is available to them in the upcoming year. We'll indicate that they can do nothing and they can automatically be enrolled in their plan with the tax credit if applicable on December 15th, or they could come to us or come to one of their certified assisters and they can actively opt in to that renewal, or they can shop for a new plan if they would like. So other customers might receive a different notice depending on their circumstance. So if their plan's not available to them in the upcoming year, they're not eligible for their plan, or if they're receiving the tax credit but we can't redetermine that tax credit for the following year, they're going to receive a different notice that basically is telling them that they do have to take some action. So they're going to be told that they need to reapply and they need to reselect or reshop for a plan. And customers will have to do this by December 15th if they want January 1 coverage. So again, these notices are beginning, they will start to be sent October 20th and they'll run through October 31st. So we'll send them in a batch process. So your customer might receive a notice on October 21st and another one of your customers could receive it on October 25th. So we'll have a week of noticing. It's also important to note that these notices will be generated from account information as of October 1. So any change reported by the customer after October 1 will not be reflected in the notice. Okay, moving to November. So November 15th, open enrollment begins and will run through February 15th. At this time, current customers can start to update 2015 eligibility, compare, enroll, and purchase plans. Additionally, as part of the annual eligibility redetermination process, Connect for Health Colorado is required to verify income information each year for enrollees receiving the federal tax credit. Income verification is a batch process that will be done with a federal data services hub. Customers do not need to submit information to Connect for Health Colorado for this verification. We will use the most recent income information we have on file for this verification. If we receive new information from the Federal Data Services Hub that might make a customer newly ineligible for the tax credit, we must notify the customer of this data mismatch. This noticing will most likely occur in early November, and if a customer falls into one of 4 buckets that will be reviewed in a later slide, they will be noticed and directed to reapply for the tax credit and select their plan by December 15th to avoid a gap in coverage and maintain their eligibility for the tax credit. And customers can start reapplying for the upcoming year when open enrollment begins on November 15th. So it's important to note that customers might have received the notice earlier that said that they were eligible for auto renewal and auto eligibility redetermination, and then shortly thereafter, based on new information that the marketplace receives from the Federal Data Services Hub, they might be sent a second notice indicating that they actually do need to take some action. They need to come to Connect for Health Colorado and they need to resubmit their eligibility application if they would still like to receive the tax credit in the following year. And then they need to take one last step then to then select their plan for 2015 as well and finish the plan enrollment process. And in order to have the January 1 coverage, they'll need to do this by December 15th. And speaking of December, December is heavy with deadlines. So by December 15th for January 1 coverage, if a customer makes no change to their account and they're still eligible for auto redetermination or auto plan renewal, then they will automatically be re-enrolled in their plan on December 15th. So if a customer didn't fail this federal income verification, they're still eligible for their tax credit and their plan is still available to them, and they didn't say anything to the marketplace or their trusted assister, then the marketplace will assume that they would like to be re-enrolled in their plan as of January 1 and will send that information to their carrier on December 15th so their carrier can begin to process that information and appropriately bill the customer for the following plan year. Now, if a customer received a notice from Connect Health Colorado indicating that they must reapply and select their plan, they must do so by December 15th for January 1 coverage to avoid that gap in coverage. So for a customer whose plan is no longer available to them, or they're no longer eligible for their plan, or potentially they fell out of the federal income verification service, they will have been noticed indicating that they need to take action, they need to come to the marketplace, and they need to reapply and reshop. And in order to secure that January 1 coverage, they need to do this by December 15th. And lastly, customers' first payment for their 2015 plan must be sent to their carrier by December 25th in order to activate their January 1 coverage. So invoices will be sent by the carrier to any customer who didn't use the online web payment service. So for our auto-renewing customers who had a no-touch system, they didn't touch the marketplace, then they will be invoiced directly from their carrier. But anyone who does come to us and they decide to either actively opt into their plan or shop for a new plan, they will have the opportunity to make that first payment online, and they can do that beginning November 15th. Now we're going to review two separate process flows that walk us through the customer experience if a customer is, one, not receiving the tax credit, and the second one for customers who are receiving the tax credit. These are high-level process flows, and again, we will provide more details on the customer experience in future weeks. So the first process flow we're going to review is for customers who are not receiving the tax credit. So they're just enrolled in a health plan without any financial assistance to pay down their premium. So you'll see we have two different paths that a customer could go down, and it's all dependent on whether or not their plan is available to them in the upcoming year. So if the individual plan is not available to them in the following year, or they're no longer eligible to be enrolled in that plan, they're going to go down to the bottom of the screen and they're going to get the must reapply and shop notice. And this notice requires customer action. So the customer can either come to us beginning November 15th and shop and select and enroll in their health plan by December 15th to ensure January 1 coverage, or they don't come to us. So if they don't come to us by December 15th, then we would have to terminate their plan at the end of the year, and they would have until February 15th, because open enrollment will still be available to them, to purchase a plan for 2015 coverage, but keeping in mind that if they come after December 15th, then they would have that gap in coverage and their plan wouldn't start until February 1st or March 1st at the latest. Now, if you look to the top of the screen, if a customer who's not receiving the tax credit, they're just in a plan with no financial assistance, if their plan is available to them and they're still eligible, they're going to get another notice, and they're going to get a notice that basically says you're eligible for your plan next year, it's being offered, this is the price of your plan, you don't have to do anything if you don't want to, or you can come to us when open enrollment begins November 15th. You can look at your options and you can purchase a new plan at that time if you would like. So there are 4 different customer actions that could occur after someone receives this eligible for plan renewal notice. The customer doesn't have to do anything. Again, if they don't do anything on December 15th, Connect for Health Colorado is going to automatically send their enrollment to their carrier, and they will be enrolled for January 1 pending payment. And that's what we call an auto renewal, and that's really that no-touch process. A customer also can decide to opt in to their renewal. So they're told that their plan that they're in 2014 is still available to them in 2015. They're happy with that plan. They want to keep it, but they want to affirmatively opt in to that renewal. Beginning November 15th, the customer can come to their user account. They can work with their trusted assister, and they can select that option in their user profile to opt into that 2015 plan. Or they can come to us beginning November 15th and they can decide to opt out of that plan renewal. And what that means is that they're saying that they want to actually go and they want to look around and they want to shop. So if they select the opt out button and they hit continue, then they are going to be required to make a plan selection. They can still select the plan that was described to them in their notice, or they can select a new plan by December 15th for January 1 coverage. And then lastly, the customer could opt out and they could not shop. So it is important that if you and your customer decide that you want to opt out of the auto renewal, that there is going to have to be some type of action that needs to occur by December 15th to ensure your January 1 coverage. Because if a customer or you and your customer select opt out and then you do not shop by December 15th, you're at risk for having a gap in coverage for that customer. Okay. Now moving on to the second process flow. So this is for customers who are receiving the tax credit. So in 2014, they are receiving some help paying down their premium each month. So again, our customers will be broken into two different buckets as far as the different notices that they could receive. These notices, again, are co-branded with the health insurance and dental carriers. So first we're going to have to look at to see whether or not the customer is eligible for auto redetermination, and we'll talk about what that is in a future slide, as well as are they eligible for their plan next year. So if a customer is not eligible for auto redetermination or they're not eligible for their plan in the upcoming year, they're going to get the notice in the bottom left-hand portion of your screen. That is the must reapply and shop notice. And again, this notice is going to requires action. So if a customer receives a notice saying that they need to come in on November 15th and they need to shop for a plan, then they're going to have to do so by December 15th. And again, you can see the two different actions that could occur after receiving this notice. Now, if we move up to the second bucket that a customer could fall in, it's for customers who are eligible for auto redetermination of their eligibility and auto plan renewal. So if we are able to redetermine the amount of their tax credit for the following year and their plan is still available to them, they will get the eligible for plan and tax credit renewal notice. This notice, again, will be co-branded with their carriers. It will provide the amount of the tax credit that we have determined them for in 2015, and it will also provide the plan information that is being offered to them. So it will have the plan name as well as the premium amount in the notice. And after they receive this notice, they might also receive a separate notice, and it's all dependent on whether or not they fail that income verification. So because these are customers who are receiving the federal tax credit, Connect for Health Colorado has to verify their income. And so if we verify their income and they fall out into 4 different buckets that we'll talk about in the next slide, then they're actually going to get a notice after the green notice that says, I understand that we told you that you didn't have to take any action, but we've received new information about your eligibility for the tax credit that's going to require you to reapply and reshop in order to secure your January 1 coverage for 2015. So that's going to require the same actions as if they would have gotten the must reapply and shop notice. So they're going to have to come to us by December 15th to ensure January 1 coverage. Now, not all of our customers are going to fail income verification. So some of our customers, they would have received the green notice, the eligible for plan and tax credit renewal notice, and then they don't fall out of income verification. So everything goes smooth and we're able to verify their information. Then again, they have the same 4 options that our customers without the tax credit had as well. So they don't have to do anything, They can say, I'm happy with the information in my notice. I'm happy with the amount of tax credit you've redetermined me for the 2015 year, and I'm happy with my plan. I'm not going to do anything. Great. On December 15th, we'll send all that information to their carrier so their carrier can invoice them. Or they can say, you know what, I am happy with the information in the notice, but I just want to go ahead and log into my account and I want to opt into this redetermination and that renewal, and they can do so at that time, beginning on November 15th. Additionally, they can decide to opt out of their auto redetermination and auto plan renewal, and if they opt out, they can go through the application again. So maybe they don't understand or they don't think that the amount that we redetermined them for the tax credit is right, or they've had some type of change to their income, or they know that they're going to have a change to their income in 2015, they can opt out of the auto redetermination plan renewal. They can resubmit an eligibility application, get a new determination, and then they can go ahead and shop for a plan. And then just like our customers who aren't receiving the tax credit, if they opt out and they don't do anything by December 15th, then that means that we're going to have to, we're terminating their plan as of December 31st, and they would have until February 15th, because open enrollment is still available to them, to select a plan if they decided to come back to Connect for Health Colorado. Okay, so this next slide outlines why customers will receive different notices and trying to outline how we are identifying customers for each notice. So the first notice you'll see is the co-branded notice that will be sent with our carriers beginning October 20th. It's the eligible for plan and tax credit renewal notice. So a customer will receive this notice if they meet the 3 criteria on the right-hand side, which is that customer, all members of the household are still eligible for their plan next year. So if there are 2 individuals on a catastrophic health plan and they are still under the age of 30 by January 1, they're considered still eligible for their plan next year, and since both of them are, they meet that first criteria. The second criteria is that their plan is still available in the next year. So that catastrophic plan that they're still eligible for, it's still being offered by their health insurance carrier in the upcoming plan year. And then for our financial assistance customers, third requirement that they need to meet in order to receive this notice would be that we are able to redetermine their tax credit for the following year. So if all of these criteria is met, then our customer will receive the eligible for plan and tax credit renewal notice. And again, the tax credit part is only applicable to those individuals receiving it. If they're not receiving the tax credit, it would just be you're still eligible for your plan. And this is the notice that requires no action, and if no action is taken, then on December 15th, we will send their information directly to their carrier for enrollment in 2015. The second notice on the slide is the must reapply and shop notice. This is the first notice that a customer would get beginning on October 20th, and again, this notice will be co-branded with our carriers. So individuals that will receive this notice, if any household member is turning 65 by the renewal date, so by January 1, they will be pulled out and they will receive the must reapply and shop notice. And that's because Connect for Health Colorado can't determine whether or not this customer is going to be enrolled in Medicare as of January 1. So in order for us to make sure that we aren't inappropriately enrolling individuals or over-insuring individuals, we're going to need these customers to come back to us, reapply, and select a plan if they're still eligible. The second criteria for receiving this notice is if any household member is no longer eligible for their plan. So for example, if there are 2 people in the household and they're both in a catastrophic plan, but one of them will be 30 as of January 1, then that individual who's turning 30 is no longer eligible for that plan, and we will need to let them know that they need to reapply and they need to shop, and that will be sent to both household members. So they will both need to come and they'll need to reapply and shop for a plan. Third is if the plan is not offered next year. So plans sometimes get canceled year to year, or they are not certified from year to year, and therefore the plan will not be available to the customer in the following year. If this is the case, then that customer will receive this must reapply and shop notice because the plan that they're in 2014 will not be offered in 2015. And then lastly, for any customers that we cannot redetermine the tax credit because we don't have enough information, they're also going to get this notice, and it's going to say you need to reapply and you need to shop because we're unable to determine the amount of their tax credit for the 2015 year. Now the last notice that's described on this slide is specific to the notices that are being sent after we verify income information with the Federal Data Services Hub. Again, we expect this notice to be sent in early November, but it also could be sent earlier. And individuals that will be receiving this notice will fall into 4 different buckets. So after Connect for Health Colorado packages up the most recent income information we have on our customers and sends it to this federal verification source looking only at income, we will receive responses back. And if customers fall into these 4 buckets, they will then be noticed indicating that they must reapply and reshop by December 15th in order to secure their eligibility for the tax credit and their plan selection for the 2015 year. So the first bucket of folks that will be noticed that they need to reapply is anyone who the Federal Verification Service determines that there's no income information on these customers. If we get a response back saying that there's no recent income information, then we're going to notice these customers and say, you need to come to us and you need to reapply because it's unclear whether or not you are still eligible for the tax credit in 2015. The second bucket is if the federal verification determines a large difference between the information that they have in their federal records and what we as the marketplace has for the household. And we have not determined what the large difference means. For example, though, the federally facilitated marketplace is using greater than 50% difference between the information in the federal service and the information on file. Connect for Health Colorado has yet to define that. The third bucket is if the Federal Verification Service determines that the customer's FPL is above 500%, meaning that they would be ineligible for the tax credit. So if we receive this new information from the verification service indicating that a customer looks to be ineligible because their income is now above 500% of the federal poverty level, we need to notice those individuals and we need to ask them to reapply and reshop. And then the last bucket is if the Federal Verification Service determines one or more members of the household is in Medicaid or CHP plus income range. Again, because if they are in that range and they are actually eligible for Medicaid and CHP plus, they wouldn't be eligible for the tax credit. They need to take some action and they need to reapply. So anyone who receives this notice post-verification has to take action. If they do not take action, their plan will be terminated as of December 31st, and they will not have eligibility for the tax credit. So it's extremely important that if they do receive this notice, that they do come to us, they fill out the eligibility application, and they select the health plan of their choice for 2015 by December 15th. Okay, so now we're going to move into what you and your customers can expect leading into the redetermination and renewal timeframes. So from September to November 14th, Connect for Health Colorado will provide carriers, brokers, and assistance sites with notice templates and a resource guide to help you understand the notices that your customers will be receiving throughout this redetermination and renewal process. Additionally, Connect for Health Colorado is targeting between October 15th and November 1st to send carriers, brokers, and assistance sites customer renewal lists to help you understand which notices your customers will receive. So our goal here with these lists is to send you them prior to your customers receiving their notices about their renewal options, so you can have a heads up on where your customers are going to fall. So the list should be able to provide you with your customers and your clients that are going to be eligible for auto renewal, and those other customers who aren't going to be eligible for the auto redetermination renewal, which will indicate to you that you might need to have a more hands-on experience with them and really make sure that they go through the application and plan selection process by December 15th, either with you prior to that time. Additionally, previewing plans will be available on connectforhealthsco.com beginning October 15th. So previewing plans will allow you and your customers to review plans available in their area prior to open enrollment. You and your customer can browse, compare, and place a plan in the cart in advance of November 15th. But final plan purchase will not be available until open enrollment begins, which is on November 15th. And it's important to note that if you and your customer place a plan in your cart during the preview period, this will turn off any auto renewal that is available to them. This means that they will have to take action to select and purchase this plan by December 15th in order to ensure January 1 coverage. So if a customer's plan is available to them, but you put a different plan in their cart on October 16th, that is going to turn off any auto renewal of the plan that was indicated in the renewal notice. So there are implications if you put a plan in your cart, but if you and your customer know that you want a different plan for 2015, then it's great to put the plan in the cart prior, just knowing that that will stop any type of auto renewal for the customer, and there are going to have to be follow-up actions once open enrollment begins on November 15th. And then lastly, between September and November 14th, current customer reported changes will only be used for 2014 eligibility. So if a customer needs to report a change to their enrollments prior to November 15th, those changes we only be able to capture those changes for 2014. We will not yet be able to capture those for 2015. And just again, any changes reported after October 1st will not be reflected in the renewal notices that are starting to be sent out on October 20th. So if they do report a change after October 1st and they receive a renewal notice that doesn't reflect that change, that is why. It's because by the time that we run our process to identify the notices, the changes will not have been updated yet. And then moving from November 15th through December 15th, Connect for Health Colorado will proactively outreach to customers via email and phone campaigns to help them through the process if needed. So we will be doing outbounding to our customers. And then beginning on November 15th, the auto renew, opt-in, opt-out, and any 2015 change reporting will be available in customer accounts. So if a customer would like to make a change to their income for 2015, that will be available beginning November 15th. It will not be available prior to that. And then just to reiterate, if you and your customer place a plan in the cart prior to open enrollment, so during that preview period, you must come back to the marketplace and finalize that purchase in order to secure that enrollment for January 1. And then auto renewals will be sent to carriers by December 15th. So again, when we see auto renewals, that's the no-touch process where a customer doesn't have to make any changes. We'll automatically send that information to carriers on December 15th. And just one note about associations for our certified assisters. So brokers and health coverage guide associations to clients will carry forward for the renewal process. Okay, so if you have any questions, we will be developing FAQs and we will put those in the answer section in our Help Center. So if you visit our Help Center at the following URL, you will be able to search questions for redeterminations and renewals. We will be updating that FAQ portion of our website. Additionally, if you have questions about this specific presentation or follow-up Q&A webinars or the training that's going to begin September 15th, please contact your broker or assistance network representative or your certified application counselor representative, and you'll see those email addresses below if you don't already have them saved. And then please keep an eye out for the Q&A webinars that we'll have The FAQ documents, we'll have a standalone document. We'll also have the updates to the answer section in the Help Center, and then we'll have the training material that will be developed. So we'll be able to provide kind of a one-page cover letter of a month-to-month expectation for you and your customers. We'll provide the noticing resource guides so you can understand the notices that will be sent and the language that's in them. So please keep an eye out if you're one of our certified assisters. Those will be in your online training accounts, and then for stakeholders and customers, we'll try to put as much information as we can up on the public website at www.connectforhealthco.com.